Welcome to my channel, 214 Gold. It's your boy, Mark J. Williams. I'm a certified anesthesiatech. I got 17 years experience in the OR, so I know what I'm talking about. Follow me because I'm going to help you guys as I drop nuggets on how to change your life and get you into the healthcare field with or without experience. So find a segment that you like. If you haven't found one that I haven't made yet, then it's coming. I've got a whole list of material that I'm dropping for you guys. All you got to do is subscribe. If you're not subscribed, you're not following, you're not taking the first step in trying to change your life or step in the right direction. All right, so what are we going to do? We're going to talk about scrub techs and what they are, right? I love them to death. I got a high level of respect for scrub techs. These guys are in the trenches for real. They're waist deep in it, and they sacrifice their time, their life, doing stuff, trying to make surgery safe and just make things just as possibly smooth as possible for the anesthesiologist, not the anesthesiologist, but for the surgeon. All right, so the scrub tech, these guys are the ones that you see gowned up. They're the first ones in and the last ones out, right? They're the ones that's making sure that that room is completely sterile, that anybody that comes in and out of that room is accounted for, and that they're in the proper attire. And they are the generals of that room when it comes to being around what they call the bat table. The table that they have set up, they have all the surgical stuff, right? That is, you want to talk about somebody very territorial, then you get near a scrub tech's bat table and they will bite like a pit bull, a Rottweiler, they'll attack like a pack of hyenas, whatever. Don't piss them off is what I'm trying to tell you. Stay away from their table, and if you got to get near their table, let them know that you got to get near their table. Acknowledge them. That's like walking into somebody's house and speaking first. Make sure you acknowledge them with any step that you plan on doing in that operating room until they're comfortable enough and they know you. Once they get to know you and they know that you know how to maneuver in and around the operating room, then they won't be so territorial. But if they don't know you, they've never seen you before, or they just don't know you, and it may take some time, a couple of months, a year. I've seen scrub techs not talk to anybody for years. They're like that, right? So don't take it personal, but their job is very serious, because if anything happens, that can affect the well-being of the patient that's on the table. Safety first. Safety is always first. Don't get it twisted. That comes before anything. So don't get in your feelings, right? It's just that's just what that is. But again, scrub techs, so they're there. They make sure that they have the case that they're going to do. They're looking at the schedule. They see the case that they're going to do. They look and they get all the instruments that they need for that case. The instruments are normally already pulled. They just have to go get it and set it up. You're talking about a job that is kind of like not tedious, but it takes a lot of planning and just attention to detail. The scrub tech is that. When you go look at and see how their table is set up, it's amazing. It looks really good, and it's well arranged. It makes sense, even though it doesn't make sense to people that have never seen it before. It really makes sense to them, and that's just the flow of the operating room. And so they have all the tools ready, so whenever the surgeon comes in, all the surgeon has to do is just come in, gown up after he's already washed their hands, or she. There's a lot of female surgeons and female doctors, and hats off to them. So excuse me if I say he. I do mean he or she, or both. Anyways, so they're important people, and they take care of what they need to take care of in the operating room, right? They make sure all the tools, the instruments, everything is available. And when it's time to go to work, they pull up, right? And so they're pulling up to the table, they're standing there. And why I tell you I have a lot of respect for them is just the fact that, they don't have access to their phone. They can't be checking their phone whenever they feel like it. They don't know what's going on outside those doors for the amount of time that they're stuck in that room, right? They're sterile. They can't touch parts of their body just because they itch. It's a level of respect that you guys will never imagine until you're in that position, or you have to be in a role similar to what a scrub tech does. Maybe be gowned in to do central lines. That's probably about the closest that you'll ever come to scrubbing in, unless you're in a small facility and you're just kind of being trained on the job. They're kind of like letting you grandfather you in a little bit, then you'll get that opportunity and you'll know what I'm talking about. But trying to stand on your feet for so many hours, not knowing what's going on, all you see is the clock, you're hearing the music of whatever the surgeon's playing, you're hearing the beeps and alarms of the anesthesia machine, and you're just listening to whatever conversation. You might have a cool surgeon that talks about cool things, you might have one that doesn't speak at all, but you're there and you're assisting them. And so it's important, because these scrub techs they have to know their cases, and they have to know each step, what's next. Whenever the surgeon sticks their hand out like this, they should be able to get the instrument and then just go in and they do it, and then they stick the instrument back out like that. The surgeon grabs it, and it's just a handoff. It's like watching a race, doing the relays, and they're running around the track and they have their baton and they're passing it off, and it's just an even exchange. The baton never gets dropped. It happens, but very similar, they drop instruments. They're very particular. They're very cautious. They're very safety orientated whenever they're changing these exchanging these instruments and pieces of equipment. It's dangerous too. Also, I mean, you have patients that have different diseases and stuff, and so you don't want to get poked by a needle or stuck by a drill or anything like that because it can lead to a whole another level of problems. Trust me. So you got to be careful when you're in that environment, and that's why again I say I have a lot of respect for them because they are they get paid pretty well, but they can definitely get paid more. And again, if you don't know one, then you'll never know what I'm talking about. And if you have the opportunity to see one, if you've been in surgery or you're going to have surgery done, then definitely give a shout out to the scrub techs, because they are the ones that make stuff happen. And so big up to them. So they're standing there and they're passing the instruments and they're doing that all throughout the procedure of the case. We're making sure that the surgeon, the main guy or girl that is doing the operation, that their crew is adhering to all the safety protocols, the time out. So making sure that they're actually scrubbing in, doing it the right way, because you have a lot of new people that come into the operating room. There's a lot of students, there's a lot of observers, there's residents, first time residents, first year, second year, third year, whatever it is. When you've got veteran and you have veterans, who you can say anesthesiatech, that's what I am, but I'm speaking on scrub tech. But you have veteran scrub techs that know what they're doing, and they are the generals, and they run that room in a sense, right? So they're going to be on, whether you're a doctor or you're a nurse, there's no hope bar. If you're doing something wrong, you need to be told about it because it's just a correction. If you don't correct yourself or listen to them and you take offense to what they're saying, then you're only hurting yourself and you're going to only you're not going to be able to go far in this world. You've got to be able to deal with criticism, especially in the medical field, because you're constantly getting cussed out. So you got to have thick skin. If you have thin skin, this is not the field for you. Fellas, get out because there's been some crying, but you have to have thick skin. All right, just as much as you're cutting into it, you've got to have thick skin.